and thank you for joining us for this week's COVID-19 all-staff call. As we continue to work together to manage the spread of the virus through following the established protocols, I'm glad to share that while this past week we experienced an increase in the number of COVID-19 cases within the RHD community, we are starting to see cases trend down. Cases increased by 50 to a total of 565 as of this past week. Of the 50 cases, 28 represent patients and community members of our health centers and is reflective of the testing we are providing at 4 of our Philadelphia sites. We are also seeing a lower number of cases develop for the most current week, and I'm also thankful to share with you that there were no deaths this past week. Thank you to everyone who has shared their thoughts and have continued the conversation on how we honor and memorialize the people we have lost due to the virus and other illnesses within the RHD community during this time of social distancing. This is very important, and I appreciate all the contributions made thus far. During the past several weeks, you have shared with us, and we have shared with you, true examples of the commitment of our staff across the organization to the folks we serve and each other. Examples of staff going above and beyond to ensure that we continue to provide quality service and support not only those that we serve, but each other. Thank you for being there when our community has needed you the most. Our commitment to the work we do, our embrace of our core value of respect for the dignity and worth of everyone, and each of our individual contributions are the main ingredients to the organization we know and love. Together we are better, and together we are RHD. Thank you for all that you are doing. This afternoon, we will provide you with an update to our Getting Back to Normal plan and information and insight regarding employee support, including incentive pay. We will also be sharing with you other updates, and as always, here to answer any questions you have. With that, I will pass the mic to Sean Mott, who will be facilitating our meeting today. Thank you, everyone.
Thank you, Marco. As Marco stated, I am the facilitator for this weekly call. Just wanted to take a moment to provide 2 updates. 1, the housekeeping, and 2, information regarding our weekly poll that we've started. First, the housekeeping. As you know, each week, the views that you will see are that of only the panelists, while all other views are closed. In addition to that, all lines are muted during the call. We do also offer a Q&A process, as Marco has mentioned, and there are 3 ways in which you can present a question during this process. You can use the chat feature, you can send an email to your voice, or you can send an email to the COVID website email address, which is rhd_COVID_19@rhd.org. During the call, individuals will collect those questions, organize them, and present them during the Q&A. In addition to that, we've started a polling process within this call to best understand how we're meeting your needs as a workforce and managing these weekly calls. Last week was our second polling process, and we learned from the data that we had noticed a decline in the meeting attendance, as well as a decline in the amount of time used to conduct the meetings. So we used a poll to understand if the meeting is still meeting your needs. Wow, that was a lot of meetings. So we did get the results from your polling. So thank you for those who did participate. We learned that through the poll that individuals would like to keep the time that's allotted. The majority of the individuals said they'd like to keep the time that's allotted, which is at 90 minutes. In addition to that, we learned that the Q&A process is working for the majority of those who responded to the poll, and the format is also helpful. We also learned that you, as individuals within our workforce, continues to get the information that you need from your leadership. The information we received was favorable, and that's good to know. So as a committee that plans for this weekly call, we'll continue to look at data, continue to do the polls periodically, and use that information to inform how we manage the call. Understanding that we've had 2 polls recently, we're going to use this process sparingly. So we'll look at offering a poll in the future to continue to understand your needs. Thank you for participating in the poll, and thank you for participating in this call. And at this time, I would like to pass to Baroness Martin, who will talk about the employee support as well as other information regarding employees in Spotlight. Baroness?
Thank you, Sean. Good afternoon, everybody. My name is Baroness Martin, Vice President of Culture, Diversity, and Inclusion. I'd like to start off by thanking everyone for the hard work that's gone on throughout the organization everywhere, and for the small acts of kindness that continues to be demonstrated with each other. And I'd also like to thank those who continue to go above and beyond in their programs, showing the spirit and the essence of RHD values and of the organization. So thank you. I'd like to just give a few shout outs this week from allies in Pittsburgh. A staff member supported a participant struggling with their addiction and arranged for transportation and admission to a rehabilitation center. This participant historically has refused treatment and was on the verge of an OD until CPS perseverance in recommended treatment finally empowered the participant to take control of their recovery. Another staff member supported a participant who had lost their job due to COVID-19 pandemic and actually helped them find a higher paying job. The CPS support did interview prep and over the phone and mock interviews over the phone. The participant contributed much of his comfort in applying and getting the job due to the CPS's support. The RTFA, which is currently in lockdown and very hard on participants, have 2 CPSs that have taken care packages of snacks, work puzzles to the front desk so staff can come down and pick them up. The participants have said that this has made their day. It's given them a window of enjoyment and things to occupy their time and to talk about with each other over the phone when called. So a big shout out to the CPSs at Allies in Pittsburgh and the LTSR. Your work is an incredible contribution to the success of the participants and to RHD. Thank you. In terms of our RHD resources, I'd just like to mention the Employee Relief Fund, which is for furloughed staff and staff with reduced hours to apply to receive benefits and funds. Also the PTO donation, which you will get communication about tomorrow. Staff can donate vacation and sick time to staff who have exhausted their time due to the COVID-19 pandemic. Employee well-being supports continue to look on Cornerstone for trainings. DSIC is continuing to provide clinical and wellness check-ins through office hours. There's Zumba, virtual fitness, yoga classes, and nutrition support. Helping Hands is a resource that if anyone is interested in can get therapy and counseling services. Please reach out to Christy Katz Friedman if you're interested in receiving 3 sessions. Heart to Heart, financial assistance to staff in times of catastrophic events like death or severe medical situations is still available to all staff. And Truevale Credit Union is providing COVID-19 loans to members and waiving service fees. Anyone interested in any of the resources that are being provided for our employees, please see the COVID-19 page in Lawson. Again, thank you very much for all the work that's being done and being committed to the values during this very trying and uncertain time. I'll now pass the baton to Pam Kazinitz.
Thanks, Baroness. Hi, everyone. I'm Pam Kazinitz. I am one of the clinical directors in the Behavioral Health and Housing Division and also a member of the GSIC team. And today I want to talk to you about another staff support, and this one is around the unfortunate event of a client or participant death or other stressful or traumatic experiences a program may face. And we're calling this the SOS team, and SOS stands for Sharing Our Support. The concept of SOS has been around RHD for many years. Some folks may be familiar with SOS. Others might just have called it something else as simple as staff support or staff crisis support. But the truth is at RHD, we've always served the most vulnerable people. And sometimes we lose those people and they pass away. And because of the amount of time we spend and often the intensity of our service, it takes a toll on staff. I've often heard that sometimes losing someone was like losing a family member or friend. We have lost people to COVID-19 in our RHD community. And we've also lost people for other reasons too, because people are still struggling with other medical conditions, with addiction, isolation, sadness, anxiety, and loneliness. And all those other issues have just been amplified in our current environment. And so SOS is a process that a member of the team comes and meets with staff. It's not group therapy. It's not meant to figure out what happened. It's outside of any inquiry that might be happening, internal or external. It's just a space for people to come together and to talk about the impact of the loss or the event on themselves and on their team. And it's a space to remember that there's no one right way to think or feel about anything. I've done enough of these debriefs to know that losses bring up other losses. And so part of the SOS team is also to link people with other available supports like helping hands or other wellness and well-being tools. So if you think this would be helpful, you can contact your clinical director or the GSIC team by emailing the clinical quality group. You just have to search that in Outlook. And I also just want to send another plug to really send your ideas to memorialize people. We're going to meet to talk more about that later this week. So would love to hear more of your ideas because we want to honor all of those people that we lost during this time. So thank you very much. And I am now going to hand it over to Sandy.
Good afternoon, RHD, and good afternoon, everyone. I'm once again, thank you for your hard work in the community and with the individuals we provide services to. I'm just going to give you a quick update on the reopening of the various programs and sites that have been closed. The committee is happy to announce that we've already received responses to the readiness assessment tool, and that we have begun discussions and meetings around opening sites that have been closed within various leadership team members to continue to provide advance notice for when we work environments may begin to change. We want to communicate that there is no plan to change current work environments before June 15th. We're still planning for a phased-in approach for returning to the workplace. Please remember to share any questions or concerns related to returning to the workplace planning with your leadership team members. Thank you. And I am not sure who I'm passing this to.
That's quite all right, Sandy. It's now going back to Marco. Marco?
Okay, I'm sorry, Marco.
Thank you, Sandy. Thank you, Sean. And again, thank you to everyone who is thinking through and using the assessment tool and beginning to think about what is needed in order for us to quote unquote reopen RHD or come back to full operation. So looking forward to seeing how that continues to develop for us as an organization and for each of our individual programs. The baton was passed back to me to share some insight with you and to share some thoughts around where we are and decisions we've made around incentive pay. So as many folks understand and have an awareness of that, over the past several weeks, we as a leadership team, leadership from various levels within the organization, we're meeting to, or have continued to meet, to really find new and effective and meaningful ways to support each of you and all of our employees during this COVID-19 pandemic. Many of the ways that we have identified to support staff, Baroness had mentioned and shared earlier on this call, and we have shared those resources with you along the way. One of the initiatives that we enacted was hazard pay, and as it stands right now, hazard pay at RHD is for staff who work face-to-face with consumers who must quarantine or isolate due to a positive COVID-19 test result or have COVID-19 symptoms following exposure. So it is focused on, again, supporting staff that are in a known environment of risk, that are working face-to-face with consumers that have had a positive COVID test result or have symptoms.
Hey, I'm so sorry to bother you.
Hey, Sandy,
Quickly,
you're not on mute. Oh, there you go. In recent weeks, the executive team and other leadership of the organization had explored the possibility of providing incentive pay. After close evaluation, we arrived at the very difficult decision that we are not able to provide incentive pay to staff at this time. The decision that we've come to is not reflective of what we believe our staff deserve and the value of the incredible work that our staff is doing every single day. This decision doesn't reflect the commitment of our staff to the folks we serve. The decision is reflective of our commitment to ensuring that as an organization, we are making decisions that not only allow us to continue to provide excellent service during these challenging times, but also allows us to continue to be financially sustainable in the future, but also be that organization that is ready and able to provide meaningful services to the thousands of people we serve every day, and many more. Finally, again, this decision is rooted in wanting to be an organization that continues to support our staff in good and bad times in the days ahead. We know that many of our staff will feel frustrated or angry with this decision. Please know that we heard you. But unfortunately, we are unable to bridge the gap between what we want to do and what we can do at this time. Funding has not been made available to allow us to support our staff in all the ways we would like to. While our health centers have received specific funding as being a healthcare center, and many hospitals during this time have also received significant funding to support their operations as well as to provide testing. Federal, state, and local governments have not been as proactive in providing mental health, IDD, or some of the other services RHD provides with funding to support the added costs associated with the necessary response to the pandemic, including hazard pay or incentive pay. We continue to work hard. We are working hard to advocate for the funding while realizing we cannot rely on it. We know this time is incredibly challenging for so many of us in so many ways, professionally and personally. We also know that every single one of you and every single person we support, that is what makes RHD such the incredible, unique, compassionate organization that we are. We have been through difficult times before, and we will get through this difficult time using our values to guide us, our kindness to each other to ground us, and our determination to see it through. I'm certain that you will have questions relating to this decision. We are available today to answer your questions, but also ask that you share your questions after today, either directly with me or with any member of the executive team. We also, ask you if most comfortable for you to share your feedback and any question you might have through RHD's anonymous suggestion box, your voice. So again, I want to thank each and every one of you that are on the call today and all of our staff that are not able to join us today for your continued commitment to the folks we serve and each other. And know that we will together continue to determine what is needed to support us, all of us, through this pandemic. Thank you. Sean, back to you.
Thank you, Marco, and thank you to each of our panelists for your updates today. This is the time in our presentation and our call that we field questions from our workforce, and the panelists will respond to those questions. As those questions are coming in and we are organizing them, just wanted to remind you that you can send a question through the chat feature. You can also send a question to your voice or the RHD email that I mentioned earlier. As the questions continue to come in, I noticed that there was a question in the chat to Sandy regarding clarity for the time change or the date change from June 8th to June 15th.
And I think
Yeah,
Stephanie helped me out with that as well. The thing is that we notice between our assessments and just looking at all of the programs and the sites, we have to put consideration into county and state regulations as well as what we're able to do. And we found that we were getting very, very close to the date that we wanted to make these changes. So in order to be thoughtful and in order for folks to feel as comfortable as possible, we pushed it back an additional 10 days to give people the opportunity to get sort of their plans in place and get all the PPE they need and to make sure that all the staff are comfortable or as comfortable as can be coming back to work. So I don't know, Stephanie, did you want to chime in reference to that? Because I see you answered one of the questions.
I think you covered it, Sandy. I just kind of jumped in there while you were taking care of some things. But yeah, we're going to use the opening schedule for the various counties. I don't want anyone to think we're discounting that. But in addition to that, we're also going to make sure that we have the proper supplies and information and are just essentially set up so that we can do this as safely as possible.
Thank you, Stephanie, and thank you, Sandy. I want to partner with Tara as well as Sarah to continue to field questions and pose questions. Oops, getting a signal and just confirming that's better. Nope.
Sean, you're fine.
Yes. Oh, I'm fine. Oh, great. Thank you. All right. Just going to partner with Sarah as well as Tara and posing questions that have come in. Do we have another question that's come in?
Sean, we have a series of questions. I'll go ahead and get started. The first question is around isolating consumers, and we're going to give that to June or Stephanie. And the question is, do we have any protocol that would address appropriate actions program staff should take if someone has been staying with family for the better part of the last 2 months? What should the programs be looking at for the person to re-enter the program?
Hello, can you hear me? So if someone is re-entering the program who has been away, I think the way that we want to approach this, and we'll try to put something together a little bit more formal for you. This is an excellent question, and I don't believe it's one that has been addressed in our documentation. So we will make sure that we memorialize this, but you're going to approach this as you would with any individual whose status is unknown. So you're going to follow the temperature taking protocols. You're going to ask or determine the answers to those health screening questions. And then we are going to use universal precautions. So that simply means, as a reminder, that we will treat the person and ourselves as if we have been exposed. You're going to take all of the precautions as if the individual has been exposed, including looking at the 14-day quarantine period. So I hope that's helpful, but it is a great question, and I think it's something we should probably memorialize for everyone.
Thanks, Stephanie. The next question is actually a little bit of a follow-up to that question, and I'm going to send it to you as well. It's about specifically when states and counties begin to move to the yellow phase, how does this affect our consumers that are in their own personal homes or group homes? Some counties have already begun to open, and they're looking for some clarity around what they should do.
So similar to the opening up procedures, for those consumers that may be in those counties, we're going to make the decisions about whether those programs are open in the same way that I just spoke about. So we're going to use that as a factor in assessing our readiness. We should be standing ready to take consumers back who are in residential programs. So for the yellow county situation, we really are just talking about those programs who were either closed or had a reduced schedule or a reduced involvement. If you are in a residential program, those programs officially never close, so we need to be ready to take those consumers back in.
Great, thank you, Stephanie. Alicia, our next question is for you, and it's around PTO. And the question is, what are we going to do for our PTO eligible employees who return to work but are sent home because they may have a cough or fever and can't return for 72 hours? This is potentially 3 days of no pay.
Hi, thanks, Sarah. So that is something that we are looking at. Again, as Marco stated, we're looking at the support that we're providing to employees across the full range of supports. So it's not just hazard pay, or it's not just incentive pay, and not just the PTO that we've already advanced, or the benefits to employees that we continued even though some employees weren't working. We have to kind of look at all of it together. And so that is one of the things that we will have to take a look at to determine if there's any other type of emergency supports. One of the advantages that we will have is that part of the employee support domain work that Baroness and that team has been doing includes something that you guys will be getting, which is a bank of PTO donation. And I'm hoping I'm not jumping the gun a little bit too early, Baroness, by letting the cat out of the bag. So I don't know why you would ever put a beautiful little cat in the bag. But neither here nor there. We are, and Baroness has been working very hard behind the scenes to secure a bank of PTO sick time donated by employees across the corporation to be available to employees who are currently working and have already utilized all of their sick time that they had available, in addition to the sick time that we advanced them. So that is something that we are working on as well behind the scenes. And again, that may not be the end all be all answer, but it is another step that RHD has been taking to try to continue to provide support to employees. So I hope that answers what the question is, Tara. If you think that answers the question, let me know if it does not. And if Baroness wants to jump in, if Baroness does or not. Yes, ma'am.
Alicia, I think you answered the question, but I do have another question for you if you're ready. The next question is about unemployment claims. And the question is, when we receive unemployment claims that are sent directly to the programs, how should these be handled? Is there somewhere else they should be being sent to?
Yes. Any government documents related to employee employment should be sent directly to shared services. If you have any questions or doubts, most people know anything related to unemployment comes into either benefits or payroll. Any income verification comes into payroll, garnishment information, any Department of Labor audit information immediately, because these things are time sensitive. Now, fortunately, we are in a situation where the external support that we use to manage some of our employment does send us electronic files. So we're not just paper dependent, but we do have a responsibility to turn around some of those documents. Part of what we do with them comes over to us electronically. The other part comes over in paper form. And if you at the program level are getting those items, please immediately forward them to either benefits department or payroll department.
Thanks, Alicia.
Sure, not a problem.
Marco, I know you answered this in the chat, but just to make sure everybody got the message, this is about this is about COVID cases. Can you repeat the number of COVID cases?
Sure, Tara. Sure. So we currently have 565 cases, and that includes staff and consumers, but also includes patients of our health centers and members of the community that our health centers are providing testing for. So it's an all-inclusive number of anybody within our larger community that has either suspected or known COVID.
Thanks, Marco.
Yeah.
Stephanie or June, I'm hoping you can answer a question about temperature taking. And the question is, why are we taking temperatures of consumers every 2 hours when the CDC is only recommending AM or PM?
Hello, I think that is probably a question for Brandon and or Linda. That's not a protocol. June and I specifically use CDC guidelines, so that's probably something that's program specific. So I'm going to punt that to Brandon.
That may be a county protocol.
Yeah, and I would recommend we, not to push the question, but I probably need to speak to that offline because there are very specifics for various counties and various programs. So I encourage you to reach out in the chat or shoot Linda and I an email, and we'll be able to follow up with you on that after the meeting today. I appreciate that because it does vary, as June alluded to, it does vary by county and certain providers.
Thanks,
Funders,
Brandon.
excuse me, funders.
The next question's about working from home, and I think it could go to either Alicia, Linda, or Brandon. And the question is, will those who don't have contact with people for their positions be able to work from home?
So I'll start and then anyone else can jump in. So again, the ability for an employee to be able to do their work remotely is something that is typically determined by the supervisor or manager that understands the work that is necessary for them to do the best, as well as they're the persons that is responsible for maintaining the level of productivity for either their program or their department. So that is not something that we are able to just kind of decide corporate-wide that this is what's going to be done. We are saying that if you had that ability to work remotely and you are currently working remotely, I think as Stephanie and Sandy have said, we are currently, based upon all the information we have available, we're anticipating a June 15th beginning to return to full operations, but in lieu of that, anybody who is currently working remotely will continue to do so, understanding that as we begin to return, that will be a phased return, and that the decisions around who's able to and how frequently or how many people or what the arrangements are going to be, they are going to be part of that readiness assessment that is being sent out that we're asking programs and or departments to complete so that we are clear about what things need to be addressed and modified. But then I will kick it over beyond that to Brandon, Linda, and Emily to speak specifically to their service lines if there's a question about that particular service line.
Sure, thanks, Alicia. And as Alicia said, until June 15th, we're not making any changes. Every program is doing an assessment that is extremely thorough and is looking at all of those questions. Much of our work, many of the work that moved to home, to remote work, we're able to get a lot of the job done that we had before, but some of it has changed. And so as we're considering that, the first thing we're taking into account is meeting the needs of our participants. How can that be? And then looking at flexibility, the teamwork, there's many, many things that go into it. And it could look different for each program. So again, that's building your plan in each program and working with the unit director, service line director, EVP, CPO, and making a plan for each program. Brandon?
Yeah, the only thing, thanks, Linda. The only thing I would add to that is, just as Linda alluded to, you do have until the 26th to do the workforce readiness assessment survey. So I would encourage you to please do that if you've not already turned that in. You will be able to give us your feedback, and it actually focuses in some of those areas. So it's not just responding to what you might do globally, but also to specific positions, which ones are working, which ones are not, as far as a remote basis, and allows you to give your input into that process. So I would encourage you to please fill those out once again if you haven't. If you're a supervisor of a day program, it's easy to make that decision. If you're a supervisor who has both admin offices and a site that has been closed, we would want you to submit feedback for both of those kinds of sites. Just make sure that you're getting your responses in, you're talking to your folks, and you're presenting that full picture to the leadership team. That way that, for lack of a better title, again, that reopening team looks at all of those responses and has a full gamut of information to act from and to make decisions upon. So we appreciate your feedback.
Thanks, everybody. Marco, the next question is for you, and it's around advocacy and hazard pay. The question is, what are we doing to advocate for government funding that could cover hazard pay?
Thank you, Tara, and thank you to the participant who asked that question. Advocacy takes on a lot of different forms, and it can happen in a lot of different ways. What I could share with you is we are partnering with the organizations that we are members of, whether it be here in Pennsylvania or nationally, to advocate for funding for hazard pay, but also continuing to advocate for wages, as well as funding for other needs during this pandemic. So, advocacy through our membership organizations, typically, again, if we utilize the resources provided through those memberships, as many of you have seen in several emails that I have sent out, but also others that I've sent out, trying to make it as easy as possible for us to advocate to our state and local representatives. So I would encourage staff to look out for those emails and also share with us any opportunities you see for us to advocate for the work we do, for the folks we support, and for our staff along the way.
Thanks, Marco. The next question is also for you, and it's about incentive pay. The question is, I understand that RHD may not be financially able to give monetary incentives. Can you give time off incentives, days off at a later date to reward staff?
Thanks, Tyra. Again, thank you for the question. One of the things I didn't mention, although maybe implied in what I shared earlier today, was we will continue to evaluate as things progress our ability to support staff in ways that we're not right now supporting staff, right? So new and creative ways, whether that be incentive pay, whether that be, as Alicia has shared, continuing to look at paid time off and what's needed and what's available. And again, the suggestion is a great one in terms of providing time off for folks in lieu of. However, what I would share is that works in certain circumstances and maybe not in all circumstances where that is a option that would benefit staff, but also, again, keeping in mind the financial impact to the organization, the costs associated with it. So in some roles it's easier than others, but it's definitely something that could be considered along the way.
Thanks, Marco. Stephanie or June, I think the next question is for you or one of you. The question is around testing. And it's specifically, when testing is widely available, how will we use that testing at RHD during our return to work process or other consumer protocols?
So I'm going to answer that question in two ways. The first is, we are assessing the return to work situation specifically geared toward what that program does. So how testing will figure into that really will depend on the nature of the program and the services provided. The other part of it is we are actually in a process now of talking through so that we can get an understanding of how best to use testing. So as everybody, or as many people know, there are all kinds of tests that test for perhaps for the virus itself. Sometimes you can test for antibodies, but what we want to do is make sure that we're using testing responsibly and in a way that's really going to have an impact on the health and safety of everyone at RHD.
Thanks, Stephanie. There was a follow-up question to this about where we're offering testing. And Emily is not on the call today, but FPCN is offering testing at their locations. If you go to the website at fpcn.com, you can see the locations, but I believe it's 11th Street, Health Annex, and Abbotsford are all offering testing. Linda or Brandon, the next question is for you. It's about protocol. The question is if I'm in a county that goes yellow and I visit clients in their homes, is this something we're able to do?
You know, that's a great question. I think, you know, it's going to be a case-by-case basis, right? We want to assess the risk. If a county is going yellow, you know, we want to be able to try to make a decision based upon what the state, the county, the funder, and RHD, our team, is saying is safe and appropriate for both our consumers and for our team members. And if we feel that it's safe and appropriate and we get the, you know, our green light internally, even though it's yellow in the county, if we give our green light, then we're ready to move forward. And that would include ensuring that you have the proper PPE and equipment necessary to do that. That, you know, again, we're not putting you in any unsafe environment that you wouldn't be able to do as an essential worker. And that we provide you, again, with the background and knowledge going into that site that you can provide the care necessary for that individual. So if all of those things go green for us and we have a go, then we'll have a go. If it isn't, then we're going to wait, make sure we have the planning and preparation in place to protect everybody involved in that situation.
And Brandon, doesn't that hark back to the plan they have for that specific program for the readiness, and that should be dealt with specifically for the different services provided?
Agreed. Yeah, and that's part of that consideration when you provided your feedback. She's referring to the readiness assessment survey that just went out. So we want to see where you are and the questions you have and help us to identify what is safe. And also throwback, I want to make a remark back to a survey that was done many weeks ago in the initial stages of COVID, where we asked you for your plans for your sites, right? What were your emergency preparedness and disaster preparedness plans? And what did you have in place? And if you didn't have it in place, what were you working on to prepare for that? So I think it's going to be a matter of looking at, again, the big picture, that again, we have those things in place to protect you and our consumers. It's likely, even in a yellow situation, as you're probably aware, we're not going to reopen with our full caseload, right? It's going to be a phased in. Stephanie said this a moment ago. It's going to be a phased in approach. We do it safely. We get our processes in order. We're already seeing businesses, churches, other people doing that right now, where the occupancy is different. The ingress, egress is controlled and staged. Spots are mapped out. We have X's on tables in restaurants, or you have X's on floors where people can be in certain areas. So I think a lot of things will happen that will better prepare us for that time when we do go yellow. And then internally we go green and we say, we're ready to move on this.
The only thing I would add to that is that we've seen and heard about some states or areas that have loosened the restrictions and then, are considering, reinstating some of them. So the plans that we make are going to be in partnership with communication, looking at local regulations, looking at our internal standards and what we feel is best practice, and are fluid. That, we just need to, for quite a bit of time, making sure that we are making best decisions for the people that we're serving.
Thank you, everybody. The next question is about return to work. And I think it may be best something that Linda or Brandon or somebody working on the opening team could answer. And the question is if a staff member does not feel safe enough to return to work and have direct contact with clients due to their own personal health or someone in their residence who is high risk, will they be able to continue working remotely until their program has implemented a plan that they feel comfortable with?
So part of the work readiness questionnaire that's coming out to programs will also include an employee readiness survey that we're going to be asking staff to complete, or managers to complete with their staff, supervisors to complete with their staff, to be able to understand what the needs of the program or the needs of the corporation are and the needs of the employee are in terms of preparing to return to work. I think that normally, and you know, with any circumstance, there needs to be an understanding of what's required as well as what's possible. We've been able to identify and be a little more flexible around that. But ultimately, there will come a point where everyone's going to have to be able to kind of begin getting back to business as usual. I don't know that anyone's going to be able to give a set time frame for that for every employee across the corporation. But it will be something that needs to be determined with guidance. You know, we're of course going to have some parameters around that for everyone, but that will be determined. And I don't know if, since Emily's not on, but if Linda and Brandon also want to jump in on that, certainly feel free. But we will be providing some overall guidance and parameters that kind of lay out limitations for how long something like that could go on, given the needs of the corporation and the consumers, for us to be able to return to work, return to full operations at some point. We're going to need to be able to provide the services that we are funded to provide. So.
Yeah, I think Alicia said it well, and it's really how can we, because everybody is juggling so much, try and work with employees, but at some point we will be fully open, you know, so trying to work together with your supervisor and your director on coming up with plans for the employee section of our assessment as well.
Great, thank you. The next question is about residential programs and moving into the yellow phase. I believe it's for Linda or Brandon. The question is, with residential programs and the states moving into the yellow phase, will consumers be able to have their family come into their home and visit again? Will they be able to go to their family home to visit? Of course, with the caveat that they would use all PPE that's required.
Right. I think, you know, the big question is, again, we're going to be following the recommendations. And part of that recommendation is unnecessary visits are just that, unnecessary visits, right? Family visits are tough because we all care about our family. And I think many of us are probably missing just getting a hug from our own family members, right? We know how difficult that's been, especially some of us are new new grandmas and grandpas and haven't been able to see our loved ones in person even. So you can imagine how difficult it is for our clients who have not been able to see their parents. It's a tough thing. So I guess I would say, well, number one, we want to have some compassion with regard to understanding that this is difficult for our clients who have been away from people they care about, and likewise for parents or loved ones who have been away from folks they love. So I want us to have compassion. I want us to have an open heart, but at the same time, we have to have a mind that protects, right? We have to have a heart that protects both our staff and other clients and consumers to follow those regulations. So I think you hit it on the head there, even in the question. We're going to have some specific items that we want to follow to be very safe. We're going to make sure that visits are intentional visits. They're not just global visits where everything is just opened up and folks come out to the site. It's very likely that we won't welcome folks into the home, but rather we would set up something outside, you know, if presuming the weather cooperates. We set up a nice on the porch or a nice off to the, you know, under a shade tree, a visit where it's safe. It's not bringing a bunch of folks into each site. So I say all that to say it's going to be site specific. We want to have a plan. We want to work with the family members, educate them on why we're going through those steps and processes, that it's not just to keep them from coming in the home, but rather we want to keep everyone safe. And our hope would be that if you go through and you educate in a respectful way, talk through that with them, let them know we want them to visit, but it's got to be done in a certain way, that folks will respond to that positively and that they will cooperate fully and collaborate with you to keep everyone at the site safe. So I'd say, yes, there are going to be some visits happening, but it's going to be, it won't look like a normal visit pre-COVID, let's put it that way. And probably won't for a while. Let me just add, I mean, I would defer to my colleagues, but I think it's going to be a bit before you see a normal visitation schedule opened up. Even after green, we're all going to be a little gun shy, you know, we're going to be careful. We need to be careful about what we're doing.
Thank you. The next question is about finances, and I believe it's either for Marco or Deanna. The question is, how are we doing financially during this pandemic?
We built
we're impacted by it, obviously. And we built February's forecast at the beginning of April. So we had only had 2 to 3 weeks under our belt of experience with COVID and how it might impact our financial statements. We obviously at this point in time have much more experience with it and do plan to have a financial presentation in the next few weeks to formally share where we are as an organization. Do you have anything to add, Marco?
Marco, I'm going to assume that's a no. I couldn't see you.
I'm sorry. Yeah, it was a no. Deanna touched on it.
Great,
Covered it
thank
all.
you. The next question is program specific, and I think it's for Linda. The question is about the street outreach services again, and
I sent an answer back to Leslie, but it didn't go to her directly. How do I get that back to her?
I'm not sure, but we can answer it, I guess, here. If you're the one who's going to answer it, let me finish the question though, so everybody can hear it. So the question's for the street outreach service, and the question is about when we move to yellow, the service they believe is a safe service to offer with PPE in place and social distancing. How can we begin to look at opening that service again?
Yeah, so I did try to get to Leslie just to say if she does need some assistance in thinking around how to offer the services in a safe way, we would certainly be able to consult with her. But I think that the program leadership, Linda, would be developing a plan around those services and any others in her division. So that should come from program leadership. That was my.
And I just wanted to add that this is the great thing about RHD. I mean, we have committed teams saying, when can we get back to doing what we're here for? I want to serve the homeless population. I want to connect them with resources. So I appreciate that because that is across the corporation. It would be part, as June mentioned, as part of the plan, and you would work on that together with your service line director in figuring out for your area and for who you serve, what is the right plan that, as we said, may have to be adjusted at different times in the future.
Thank you both. The last question that I have is about the opening coding. And I think maybe it's for June or Stephanie. And the question is from the person is, this is the first time they've heard about the colored coded phase system. Can somebody explain what it is in more detail?
I guess I'll take that one. In some areas of the country, we are speaking about the phased-in opening with a color code, red meaning no change, yellow meaning it's time to start doing certain appropriate actions with the appropriate precautions, and then green. Some areas are using 1, 2, 3. So essentially the color coding, when you're hearing folks talk about yellow, means that their area, the system for setup is under the yellow phase, and that would include certain relaxing of certain standards and specific businesses that can open and so on. And every area is doing it differently in terms of what how we're talking about coming back. And most places, because it's a phased-in approach, many are using a color scheme.
Thank you, Stephanie. Sean or Sarah, I don't have any more questions. I'm not sure if either of you do.
Checking in with, and I do not either. And I can wrap up if that is concluding the questions. First, I want to say thank you, Tara, for managing the questions to our panelists and continuing that dialogue. As a closing wrap up, before passing it back to Marco, who does this traditional closing, just wanted to remind you that this call is recorded each week. And there was lots of questions and good conversation about our organization and our moving forward. I would invite you to forward this recording to those who may not have access so that we can ensure that the dialogue continues. In addition to that, I'm going to ask in a moment if Brandon and Linda could talk briefly to the process we have in place for updating regarding programs. I know that you have calls during the week. I think it's Tuesday and Wednesday, but if you could talk to that, because I noticed in this call today, we had considerable questions about programs and there's some specific answers. So if you could talk to that, I think that would be great. And then finally, just wanted to remind you that we continue to collect questions. We manage responses to those questions and get that back out to you. So continue to bring those questions in or present those questions. And also be on the lookout for the readiness surveys that are out there that were mentioned earlier so that you can share with our workforce what your needs are as it relates to the reopening of our organization and getting back to work as we traditionally are doing. And that's a format for you to share information. So I'm going to pass it to Brandon and Linda just to really briefly talk about the process you have set up for continued communication within programs.
Sure. For behavioral health, each Monday we have this town hall meeting and we follow it up on Tuesdays with division leadership and the unit director steering committee members to review anything specific to behavioral health from that occurred over the course of those two meetings, any subject matter. Each of the service line directors then cascades that information to their particular set of programs within 24 hours. So that can look a little bit different, but the topics are covered. There's lots of opportunity in there for people to be asking questions and having the communication move sort of back and forth as new areas and questions are identified that we need to think through. So that's the behavioral health system right now. As well as an evening email that sort of summarized the day and anything COVID related and important documents changes that would happen during that particular day.
Thank you, Linda. Yeah, IDD side is very similar, of course. Monday's call here. Tuesday, we have 3 separate region meetings, 9 o'clock PAIDD, 10 o'clock Northeast region, and 1 p.m. Central is the Central region. So we do our Tuesday follow-ups, and then nightly we do the summary that goes out to the entire division staff, to program directors, and to unit directors, as well as assistant directors. Includes all division, which would be HR, fiscal staff, DSIC, as well as the executive team. So those go out nightly, and then that information we would ask that they cascade that information on down to direct line staff, team leads, site supervisors that are out in the field. And generally, we try to repeat, as Linda said, we would cover anything that's IDD specific on our side or generally specific to RHD. Sometimes we'll throw in things that are not COVID related, that may be a policy update or a change that's in there that came out in the week. So I would suggest and recommend that you take a look at our nightly summaries, both on the behavioral health and IDD side. There's a lot of good information in there, and I encourage you to take a look at it. And then, as always, anytime during the week, we have special break-off meetings where we're doing one-on-ones with various programs and regional leadership, and would ask that any of that information is shared down the line as well. But we would hope that you're getting that information. If you're not hearing that information, I would ask that you please reach out to your supervisor, let them know. You feel free to reach out to me directly as well, brandon.york@rhd.org. I'd be glad to share that information at your level. If you want in on those nightly summaries, you're welcome to that as well. It's not limited just to the divisional and program and assistant director level. It is information that we want rolled out to everyone, and I'm sure Linda would also agree. So if you want that information, reach out and ask. Let us know if you're getting it or if you have questions. We would appreciate that.
Awesome. Thank you, Brandon, and thank you, Linda, for providing reminders as to that infrastructure we have in place. And thank you to all of our panelists for your thoughtful and informative responses to our questions. I'm going to now pass it back to Marco, who will provide our closing remarks for today.
Thank you, Sean. And again, thank you everyone for participating today. And thanks to all the panelists for continuing to share the valuable insight that you share every week with our community. My thoughts for you this afternoon as we close are pretty simple, in that, as you heard today, we want to get back to quote unquote normal and provide the services that we know the folks that we serve need, and the services that we want to provide. We want to do that in a way that takes precautions and that really focuses on the health and safety of the folks we support as well as our staff. So, you know, we are seeing the nicer weather come about, you know, particularly over the past couple of weeks. And, you know, the nice weather is a great distraction to the challenges that we have every day, to the stress that we have at home and at work. And I encourage everyone to continue to focus on your own well-being as we also continue to want to loosen restrictions as well as getting back to quote unquote normal. Grab onto those distractions, enjoy them, find the time, the space for yourself to focus on your own well-being and self-care along the way. As Christy just reminded us, there is information out there on Cornerstone, support out on Cornerstone, support out on the COVID-19 website for staff to take advantage of and to utilize as you're focusing on your own well-being. So with that, as you do that, and as we continue to prepare for opening, stay focused and stay focused on ensuring that we are following protocols. Please continue to follow the protocols to keep yourself safe, to keep your family safe, to keep the folks that we support safe. And if there are any concerns or challenges with protocols being followed, as to whether or not certain protocols need to continue to follow, please surface those. It is important to us that we are doing all we can to keep each other safe and the folks we support safe as we work through this together. So stay positive, continue to have hope, and continue to follow those protocols that we have in place to keep us all safe. Thank you, everyone.